All right. We are here on the Facebook page. I'm reporter Liz Crawford here at 10 News, and this is really important. We have Dr. Jill Roberts also on this Facebook Live with us. It takes a little coordinating because everybody's stuck at home. So usually when we're doing these interviews, I'm here with the expert and we're here together talking to all of you. But right now, like I said, I'm at my house. Dr. Roberts of USF College of Public Health is at her house. We've both got kids in the background. But this is really, really important because at the end of the day, you have questions and it really is our job to get them answered. So, Dr. Roberts, but before we start taking people's questions here, I do want to just give you a second just to give your background. It's very impressive, and this really is your bread and butter. Like I said, you are a professor at USF College of Public Health, specialization in molecular epidemiology. Tell us a little bit about your background.
Yeah, so that sounds a little bit technical, but what it really means is I like to track diseases around various locations and see how they change. And so we look at different types of diseases. How does their genetics change? What part of the world are they located in? And my specialty area for doing that is global infectious diseases. So as you said, this outbreak is very much in my wheelhouse.
Okay. We've already got questions coming in, but I want to start by asking you, as a scientist and an expert behind this, you had mentioned to me that you kind of expected there would be another COVID outbreak, but there have been some surprises along the way. Can you give us just your general idea on what we've seen so far with the coronavirus?
Sure. So we did know this was going to happen. Coronavirus is known to have a mutation rate that causes these kind of problems. We saw SARS actually happen years ago, so we knew this would happen again. So we take a lot of steps to try to prepare. We anticipate where we're going to have needs and where we're going to have shortages. But I think that what really threw everybody for a loop this time is we didn't realize how quickly we'd run out of laboratory supplies. So I think that the falling apart on the testing, where we've run out of supplies, we've run out of people to gather these things, that's the part that we just didn't see coming. Mm-hmm. Unfortunately, today's news hasn't really helped. So we are really hoping to get a quick antibody test available. And the news today has been bad about that many of the antibody tests aren't working, and that's unfortunate.
Yeah, and if those aren't accurate and valuable, that could probably do more harm.
Way more harm. And unfortunately, once you relax those regulations, the idea is to get a test available faster. That's great unless the test doesn't work. Gotcha. So if we're telling people, well, your test is negative, you can go out in the world, go back to work, go to the grocery store, don't wear a mask, and those people are actually infected, obviously you can see where that's a problem. In addition to that, it's a faith issue. When people take those kind of tests, number one, many of them are paying for it. Number two, they're taking on good faith when they go home to their families and their loved ones that they're safe. And if they're not, we've done a lot of damage.
Gotcha. All right, Dr. Roberts, let's get into it. People have so many questions. One of the first things I saw was how long does it take to get over COVID-19? You come down with it, how long does it take to get over it?
Right. So different people have different results, and that really depends on how sick you get. So we're seeing some people who are having severe disease who are in the hospital for weeks. Now, even with the mild cases, and I'm going to use the word mild very broadly because the disease is no joke. A mild case still has fevers and chills and all those kind of things, but the absence of shortness of breath. Those people are still reporting being sick for weeks. There's a really famous one. You may be able to track some of the celebrities that are blogging while they're sick. You kind of notice that Tom Hanks and his wife were doing that. You can watch Chris Cuomo doing it now. We're weeks into illness with Chris, and he's still sick. So it can be a very long, extended time period that an individual is ill.
Okay. What about somebody asking here, should I be worried about picking up my newspaper every morning? Should I wear gloves and read my paper with gloves on until I'm done with my paper?
That's a really valid question, and you've seen a lot of people that are out and about that are actually wearing gloves. The problem with wearing the gloves is that we have really good data that shows we're just as likely to actually touch our face wearing gloves as we are just our hands. And so reality is the gloves don't actually help. Now, to give you a little bit of peace of mind, number one, your newspaper does not support the growth of coronavirus. Viruses need a certain environment to grow on, and it certainly isn't the newspaper. Number two, it's very hot outside. Okay, viruses do not like high heat. Number three, the sun's out. Viruses do not like UV. Now, if you're worried, what I would say to do is you could put on your garden variety gloves that you use to clean your kitchen, spray down that newspaper with a disinfectant, let it dry, and then read your paper. But the reality is it's highly unlikely that you're going to get any risk from that newspaper.
Okay. What about someone asking, when are we going to see a second wave of cases? Now, and I totally appreciate this question, because we feel like we haven't even reached our true peak in Florida, but we're already thinking ahead to that possible resurgence. Talk about that.
Sure. Okay, so this is a tricky question, and there's really two parts of it. The first part of that is to just say that when public health works, we tend to not notice. Okay, so we are looking at a pretty good scenario in the Tampa Bay area right now, in that even though we have cases, our hospitals haven't been overwhelmed yet. That's wonderful. That's what shelter in place was meant to do, to keep our hospitals from being overwhelmed. The problem is that people start to get complacent. So they say, well, the hospital's fine. I don't know anyone who has a case. I'm not sick. I'm going to go outside and I'm going to start resuming those normal activities. We don't want that, because that will actually cause that second peak. Now, in reality, we don't know if we've peaked yet. Okay, so there are models that would suggest that we're still about a week and a half away from peaking. We will never know if those models are correct until that passes, until a peak actually passes, and we can go back and look at that data and say we were right. So what we want to have is what we call kind of an N curve. Our cases go up, our cases come back down. What we don't want is the U curve, where we're up here, everybody shelters in place, then everybody says, oh, forget about it, I'll go back outside again, and boom, we go right back up again, and that gives us our second peak. And so the reality is, we can't answer that question until we start relaxing some of these things and letting people go back to work, putting people back in schools. We'll see more cases. The reality is, until there is a vaccine to prevent this, we are going to continue to see cases. But the shelter in place, as long as we can maintain it, the longer we can keep that second peak from happening.
Okay, so then let me just ask you a follow-up there then, Dr. Roberts. What are your thoughts on staying in a social distancing scenario until we have that vaccine? That obviously is a hot topic today.
Sure. So that gets really complicated. There's all kinds of factors involved about when do we start relaxing these things. So if we were to ask 3 different people in 3 different fields, you'd get 3 different answers. Ideally, from an infectious disease standpoint, I would say everyone stay inside forever until the vaccine comes. We know that that can't happen, right? There are many reasons for which that can't happen. Number one is economic. People are losing their jobs. We're seeing people losing their retirement funds. We're seeing all kinds of issues. We will see people lose their homes. All those sort of things. You do have to take steps to prevent that from happening. Another serious important issue is the mental health issues. So the reality is we have really good data showing that social distancing causes mental health issues. I hope everyone is aware that there are all kinds of services available. If you're experiencing any kind of issues with loneliness, you can reach out to Tampa Bay's Crisis Center and all sorts of areas. So it cannot go on forever. The reality is we're probably 6 to 9 months away from actually having a vaccine available. Keeping people in isolation for 6 to 9 months is usually referred to as torture. So I think we're actually going to have to see a relaxing in certain areas. Now, question becomes, can we do this in a way that makes sense to prevent a huge peak? So for example, could we allow people to go back to their workplaces? Probably, but are there some people that actually would prefer to work from home? Because we're finding that that's the case. So you just lessen the number of people in one place. Now, what we don't want to do is let's go out and enjoy a concert where there's hundreds and thousands of people, because that's what's going to throw off another peak for you. So I think you have to see eventually a loosening of those social restrictions, but not on a huge, massive scale. We're not going back to normal anytime soon.
Okay. Dr. Roberts, someone else asking, if you get COVID-19, can you get it again?
That's a great question. And to tell you right now, the scientists are arguing on this. Okay, so there are a couple people that have done some work on this actually in South Korea that have shown on the antibody test that somebody that tested negative then will test positive again later on. What's not clear is, are they really truly infected again? Are they symptomatic again? Can they spread it again? So you can see this gets a little bit complex. So right now, most people don't believe that you can get it again. But until we have a lot of data, we're not going to be able to give 100% positive on that.
Mm-hmm. Now, you already touched on this. Someone else is asking, it's been talked about that we could be in isolation for 2 years. Could this be the case? How do we get back to work? And you already kind of answered that even though as a scientist, you would love to see that, that is impossible and damaging in other ways. So there's going to have to be a balance as we move forward, but nobody has the magic answer yet.
Sure. There's no magic answer. And I don't think that we don't want to rush it. We want to be very careful. The closer we can get to that vaccine being available, the better.
Dr. Roberts, Mandy asking, is there a certain temperature that will kill this? You did talk about viruses not liking sunlight and humidity, right?
Yeah. Now, it's actually heat. They don't like heat. Now, the reality is the temperatures to deactivate viruses are pretty high. And so I've actually had people that are concerned that said, well, what if I came from work and I work in a healthcare environment? What happens to my car? Well, park your car outside. It'll be 140 degrees in there in a few minutes. Viruses don't do well with those really, really high temperatures. Unfortunately, we don't see that weather effect like we did with influenza, where it goes away during certain seasons. And that's not really a temperature issue anyway. That's people distancing, and influenza doesn't spread by the same route. So that's unfortunate. But yeah, viruses do not like heat. They actually do like cold. But the UV light factor is important. When we take that PPE, and you've seen some stories about people reusing PPE, the way they sterilize it is with UV light.
Wow. So that's, promising for at least us here in the Sunshine State, right?
Sure. And there's actually been a few theories thrown around about that, about the number of cases that are here and the number of cases that are in California. Again, that's all theoretical. We won't know until there's a lot more data, but it's interesting. It's something to look at.
Great question here. I don't know if you have the definitive answer, but how long are you contagious for?
Yeah, we don't have the definitive answer because it's really interesting. It seems like there's a really broad range before a person is symptomatic, which is something you don't see with most viruses. So most viruses, somebody is infectious 1 or 2 days before they're actually symptomatic. But with this, we're looking at a possibility of up to 2 weeks that somebody could actually be contagious before they have the symptoms. And then they're considered contagious until they test negative on that antibody test, or rather on the PCR test. And so theoretically, you could see somebody that was infectious for a really long time, upwards of a month.
Wow. Okay,
right.
This one has come up a couple times, so I'll just ask you both at the same time. Carol is saying gloves or no gloves, and I'm going to throw in there masks or no masks.
Okay, so masks is a definite yes. Okay, so we have pretty good data showing why we should use masks. One thing I think that you need to be aware of, though, is you're not actually using that mask so that you can protect yourself from being infected. It's actually protecting other people from you. Okay, so when we put that mask on, if we're breathing out viruses, hopefully that mask is collecting the majority of what might be in our saliva. However, unfortunately, you do get air currents around the sides of those. So unless it's an N95 or real PPE, which we don't want to use, leave those for the healthcare workers, you could still suck in viruses if you're out. So that's why we're saying mask, yes, and also socially distance. Stay away from other individuals, even though you're wearing a mask. Gloves, no, there's no reason to, okay? So this is a airborne droplet virus. It's not going to be something that you're going to be, for the most part, touching a surface and getting. That could happen, however, there's no difference between infecting your gloves or your fingers. If you're going to wear gloves, you're going to still touch your face. You're going to still touch your groceries. You're going to still touch your phone and your purse and all these things in the same way that you would when you're using your hands. So the reality is, Save the gloves for the people who need them. Wash your hands, wash your hands, wash your hands, wash your hands. You've gone to the grocery store, wash your hands. I always laugh about, I teach food safety, and in our food safety class, we talk about how when you're touching that grocery cart, those carts are already contaminated. They've always been contaminated, even more so now. So the gloves, there's really no point in that.
Good. I'm glad you cleared that up. Thanks, Dr. Roberts. For those of you just joining us, we are here taking your questions. I'm trying to fire them off to Dr. Roberts. She's with USF College of Public Health as fast as I can. You guys have so many great questions coming in. We're going to do this another 15, 20 minutes. So keep on asking questions. I love this one from Linda because I am curious about this myself. If you come in with your shoes, should you spray your shoes? Should you be taking your shoes off before you get in your home?
Yeah, I've actually seen that question a couple of times. And so in reality, it's highly unlikely that any virus is going to be really happy about living on your shoes. In addition to that, it's not going to be very happy about living on your floor either. And so I think that the shoes are probably really low risk. Now, the exception, of course, is do you have an infant crawling around on your floor? So if you do have an infant crawling around on your floor, you generally take your shoes off outside anyway, or away from where that person is at. But most of us aren't going to be crawling around and touching anything on the floor that could have been a contact. But it's good to know, and this goes for pretty much everything that is an inanimate object. We saw a similar question with the newspapers. They can't support the life of a virus. And so for a very, very short time frame, would any virus actually survive on that surface? Remember, the really good rule is your dangerous thing is other people. It's Great. Other people. Stay away from other people.
So there's been a lot of talk about how long the virus can live on surfaces. Can you just kind of clear that up then?
Yeah, and reality is, unfortunately, the data is really broad. So there are certain surfaces that the virus may actually live on a little bit longer than others. And one of the key factors for that is moisture. Okay, so moisture can actually help the virus live longer. So we kind of mentioned the humidity early, that works against us, actually, not for us. And so in reality, it's really hard to tell. You would have to look at each individual surface individually and do that test. And obviously, we only know about a few of them. So they range anywhere from a few hours to a few days, depending on the environmental conditions.
Okay. Ruthie Adams, I haven't heard this one, but I like it. Do I have to wash my hair when I get back from the supermarket?
Yeah, so I know people that are coming back from the supermarket that are washing their entire selves. So in reality, it doesn't do any harm if it makes you feel better. Why not? So the reality is, I talked about the mental health issues earlier, and in terms of us taking as many steps as that makes us feel like we've taken a safety measure, you could do that. Is it likely that your hair is contaminated? Highly unlikely that it'd be only your hair contaminated. So the only way that could happen would be if you were actually walking through airborne particles, and if that was the case, you're breathing them in too.
Okay. I might have you answer this one again because we've got some new people watching now, and this will keep coming up. People want to know if you have already had the virus, if you can get it again. Can you answer that one for us one more time?
Right. So I will answer it again. The reality with that is the scientists are discussing and looking into it. Most people believe right now that you probably get immunity and you don't get it again. However, there's been a limited number of cases of a few individuals who maybe possibly did get it again. Now, I want to point out one thing about that. That's common. There are individuals who can get most diseases and not get immunity from them and get it again. And so we can't necessarily make that broad distinction just quite yet until we have more data. I think in reality is we would be seeing another peak or higher peaks in various areas if a lot of people were getting reinfected again. So I really don't think that that's happening.
Okay. Couple months, let's see. We talked about this in our chat here, Dr. Roberts. Judith is asking, is there a test to show whether you've had the virus? If you were symptomatic but didn't have all the symptoms of shortness of breath, sore throat, and fever, could you get a test to find out if you had the virus?
Yeah, so these are the tests that are the hot news today. So the antibody test is the correct kind of test to do that. So the term that you might have heard of in the past is titers. is doing an antibody titer for a disease that you may have had in the past. So we generally do this when someone wants to become pregnant, for example. We might do titers and see, are they protected against measles and mumps and rubella? So you can do the same thing for pretty much any virus, because what happens is once you've been infected, you develop that antibody, and the antibody actually stays in your body. The interesting things about antibodies is there's different kinds. So there's an antibody that can tell me that you were infected recently, and there's an antibody that can tell me that you had it at some point in the past. And so when we do those antibody tests, that's what we're looking for. And it's very, very likely that a huge, huge number of people, now we have a big range here. Some countries are saying 60 to 80% of people are getting infected and have no symptoms.
Wow.
Yeah.
But we need to make sure that that test is accurate.
Right. And that's the problem that we're looking at right now. So what happens is when you relax the regulatory requirements of those tests, what they relaxed was the verification. So when you develop an antibody test, you want to verify it to make sure that it works in every case in every single person. And so what you do is you take people that you know are positive, you take people you know are negative, and you make sure that the test calls them correctly every time. What we're seeing now is some of the tests that people thought worked were actually detecting other coronaviruses. So coronavirus is here all the time. It's a common cold virus. Only rarely does it have a really serious strain like the one that we see right now. And so it looks like some of those antibody tests that hit the market really early were giving people false positives. They were being told, yeah, sure, you already had it, but you never had the pandemic dangerous one. You just had the common cold virus.
And you can see where that's COVID-19.
Sure, you didn't have COVID-19. You had some sort of other COVID. And that's potentially very dangerous.
Yes. A follow-up from Pam. If the virus doesn't like heat, then why is it in Florida?
Yeah, so you would think that it was really nice and hot in Florida, right? But where are we all at right now? We're all inside with the air conditioning running where it's a balmy 76 degrees. And so the reality is that most of the cases are probably spreading in indoor environments where it's nice and cool and where we've all gathered together, like the grocery stores and the malls and the schools and all those places. So yes, it's true that viruses aren't a big fan of heat. However, we don't spend all that much time outside, unfortunately.
Dr. Roberts, I know that this won't be your decision, but a lot of people are asking, are the kids going back to school this year?
Yeah, I think that's a huge mistake. So for one thing, the school year is not that far away from ending. We're only looking at about 6 weeks left in the elementary schools and the high schools and middle schools. And so this goes back to that issue that we said before, that when public health works, we generally don't tend to notice because it's working. So we're not seeing the hospitals overloaded and those sort of things. So you can imagine the scenario of what happens if we send the kids back to school. If we were to say next week we send all the kids back to school, and one of the reasons this comes up, by the way, is because the disease is really mild in children, but those children go home. So who takes care of them? I don't know about your particular schools in your area, but I see all kinds of grandparents picking up at my school. So because the kids' parents are at work. And so what the big concern is, we send all the kids back to school and they become little tiny vectors of disease. So now they start spreading the disease among their caregivers, their friends, and then we see this massive peak take off. So reality is we put a lot of work into getting all these programs online. The kids are actually learning online really well. I've seen great data from Hillsborough County Schools to see what percentage of kids are attending. It's fantastic. I can tell you from USF, my own classes are packed. In fact, my summer classes are filling up and they're online. And so I would say it's working. Being online is actually working. So let's not take the risk. Let's keep the kids out of school.
Okay. What about the role that building your immunity can play? Things like vitamin C and taking airborne, drinking water. What are your thoughts?
Right. So we have good data on what's good for building your immunity and what's not. So you have to be careful with this. Some of the things that are really good for building up your immune system is getting enough sleep, exercising, and eating healthy. Some things that just cost you a lot of money is buying a lot of vitamin C and airborne. Okay, so we like to say in the field, when you buy a lot of vitamin C, what you really create is expensive urine, because the reality is you can only take in so much vitamin C before you stop processing it. So I would wish to have a easy, fast cure for you, but the reality is most of us don't need vitamins unless we have a deficiency already anyway. So do the things that are tried and true over time. Make sure you are getting enough sleep. If the disease pandemic is keeping you from sleeping, make sure that you're taking something so that you can get your sleep, because it's not good to be stressed out all the time. It's not good to be not well rested. Eat healthy. We're all at home with snacks around us all the time. We can shop better. So when we go to the grocery, leave the Oreos on the shelf and pick up a bag of grapes. Once we only have that thing in the house, we will eat better. And I know we all do it, right? So drowning our fears in carbs.
They're comfort food for me.
I agree. Believe me, I know that I've always said the carbs they fill the emptiness inside, right? So, so don't beat yourself up for eating the junk food, but do your best to try to do things. One of the things that I'll tell my students a lot of times is have a cheat meal and a not cheat meal. So make sure your lunch is healthy, and then for dinner, go ahead, have the pizza and beer. These are college kids, so that's what they're going to have. And so definitely just cheat yourself. But don't spend a lot of money on things on the internet. Be real careful, because there's a lot of scams out there.
Okay. This is a great question. Why do some people not get it bad at all and others this virus kills?
Right. So we're all different in our underlying host immunities and factors. And so one of the things that we've already seen worldwide is that the people who are dying have underlying comorbidities. So a comorbidity means another type of disease that's serious. And so the individuals who have heart disease, who have diabetes, these kind of things, asthma is another factor. Once you have the two things working together, it creates a really dangerous situation. Some environmental things can do it too. So this would be a really good time to stop smoking if you're smoking, because the lung damage combined with COVID can be very, very dangerous. And so that's probably part of it. Now, all the underlying factors, we probably won't know until we do a few more years of research on this particular disease.
Okay. That's a great perspective. Should we be cleaning our groceries when we bring them home?
Yeah, so there's no harm in doing that. You can actually spray off your groceries with many different types of disinfectants. I know a lot of people are fans of Lysols. That's fine. You can use bleach products. You can use the non-bleach bleach products like the wipes and things along that lines. The theoretical spread route exists, because you see at the grocery store the individual that touches every single apple before they pick the one that they want. We do know that norovirus, for example, a foodborne virus, can spread by that route. So theoretically, it can happen. So now, in reality, the risk is very, very low. So if you're worried that you've never done this and you've never done the cleaning steps and you've put yourself on risk, it's highly unlikely you've put yourself at any risk.
Mm-hmm. Someone else is asking, are there certain vitamins we should be taking to help build our immune system? You answered this, but go ahead and just say what you said earlier.
Yeah, so it's unlikely that vitamins are going to help build your immune system unless you have a vitamin deficiency. So for example, if you've been told by a healthcare provider that you need to have more iron or you need to have more vitamin D or something along that lines, it won't make any difference. I would give a big note of caution about vitamin D. It's having a moment all over the internet. It's one of the biggest scams right now. So we live in a state that has a big giant sun. It is unlikely that anyone in the state of Florida is actually suffering from a vitamin D deficiency without underlying disease. So if your physician told you you need a vitamin, then go ahead and take the vitamin. Otherwise, that's not what's going to help. Sleep, eat well, exercise.
Thank you. What about this? Why is it taking so long to come up with a vaccine?
Yeah, so a vaccine is not an easy thing to do. Now, remember, coronaviruses have been around forever. If we could have made a common cold vaccine, can you imagine how profitable that actually would have been? People would have done it years ago. The good piece of information is we did successfully make a vaccine against the first SARS 1. And so we are optimistic that you can make a vaccine against SARS 2. However, making vaccines is not easy work. You have to make it, you have to test it in individuals, and then one of the most difficult steps is you have to market it on a huge scale. So you have to make a lot, you have to move a lot, and you have to vaccinate a lot of people. And so in best case scenario, maybe 6 months, 9 months would be way more comfortable. A lot of people would go out to even 12 and 18 months. So we have what will answer that question for us, by the way, how many months it is when the clinical trial data come in. So there are a couple of vaccines right now that are in clinical trials. If they perform well, we're looking at fewer months. If they don't, we're back to the drawing board again.
Okay. Now, this is an interesting question from Kathy, and we'll do this about 3 more minutes, guys. This was really just tremendous. Thank you so much, Dr. Roberts. I mean,
certainly,
your expertise is just so appreciated. Kathy is asking, what about being overweight? I was told that anyone overweight won't have a chance. And I think what Kathy means there is won't have a chance at recovery.
Sure. So I think that that's making things way too simple. So for one thing, that we know plenty of individuals who technically on scales are overweight are actually quite healthy. They can eat well, they can exercise regularly. There are metabolic conditions that can cause people to be overweight. In reality, when we look at the data of the comorbidities, you do see obesity in there. However, what's really hard to tease out is it because the person has high blood pressure and obesity? Do they have diabetes and obesity, or is it just obesity? So the reality is, in and of by itself may or may not be a factor. It really depends on how healthy that individual is. Not to say that they don't have a chance at all, I think is quite ridiculous, especially in a country where we do have good health care. Our treatment for the disease is getting better every single day. And so anyone who that condition would describe you, please don't live in fear. I think that that's overstating ridiculously.
Okay. Good answer. Thank you. If a pregnant person gets COVID, is their baby building antibodies as well?
Well, this is scary because we've already had babies that are born with it. And so the question becomes then, does the antibody actually cross into the child? What reality is, it's possible that the virus crosses into the child. So there's been at least one case where a 1-day-old infant actually died of COVID and the mother was infected. Reality is, we don't know. With an N number that is so low, so few people were pregnant and had the disease and then had the baby later on, we don't have enough data to know for sure. So we'll see. It's a great question because theoretically that could definitely happen. That said, keep in mind that the antibodies that you get from mom, they're short-lived. And so this is one of the reasons why when a baby reaches the age of 1, they need to get measles and mumps and rubella vaccine. They had those antibodies from their mom, but over that time, they go away.
Okay. Let's see here. We will do 2 more questions.
Okay.
Because this has just been a blast of information. We're so grateful to have you on here with us. And thank you to everybody who's participating. Judith is asking, if all symptoms are gone except loss of taste and smell, are you considered contagious?
Yeah, that's hard to tell because contagious means that the virus is actually present. So you can't determine contagiousness based on symptoms. What we'd have to do is the antibody test, or rather the PCR test, and see if the virus is still present. But you're touching on something that's really serious that a lot of more data needs to look at this. If you're having an effect on taste and smell, that would suggest the virus is actually infecting the nerve system. So the nervous system, and there's changes in the brain and things along that lines. What I'd be more worried about at this point, not so much the contagious issue, but do they restore? Over time, does taste and smell come back? Are there additional issues that we need to look at where there's actually been brain damage caused by the virus? I think that's probably one of the most scary issues attached to this virus right now, and we'll need more data to know for sure.
Okay. I think people have kind of asked this in different ways. What are your thoughts on ordering out food?
Yeah, so this has been a really hot topic, right? And so the reality is, why not? There's a very, very low risk on ordering food from various places. You can always take steps to actually, spray that bag off if you want to, spray your containers off. If you're concerned about virus survival, buy hot foods. So boiling things and things along that line is going to kill off any of the viruses. I think there's a positive effect of doing it actually, because it helps us out. For one thing, it's comfort food. Many of us like to get those different types of foods. Number two, you're helping out the economies that are remaining open. So there are various restaurants that are staying open. There are people who are delivering that food to you that are actually, they require that paycheck, quite frankly. So I would say the risk is extremely low. If you are ordering food, go ahead and keep doing it. If it makes you feel better, take the extra steps. Spray off the food, order hot foods. This is probably not the time to order in sushi.
Great advice. Thank you so much for spending this time with us, Dr. Roberts. She is a professor at the USF College of Public Health. So safe to say she knows what she's talking about here. And Lord knows there is so much noise out there. So we really appreciate being able to channel these questions right to you and get some solid answers. We so appreciate your time. And thank you to all of those that are on the 10 News Facebook page asking these questions.